Okay, this video is called Leaky Gut Follow-Up. I've already had a couple lectures about leaky gut. I'm just going to mention a few new things in here that I hope will be helpful to you. First of all, I'll start out with a background story. You know, I had a girlfriend when I was younger, just a magnificent girl who was a fantastic musician. That was her life. She went to Juilliard, and, you know, later on when I was in med school, we kind of drifted apart because a doctor and a musician, like a real serious musician, they kind of don't go together because a musician always wants to stay out late at night at the music shows and the post-show party and that kind of thing, whereas a doctor wakes up early in the morning and works all the time. So anyways, when I was in med school, you know, I was kind of real successful academic. I was real kind of arrogant. And, you know, we were split at that time. She came and asked me, though, about her mother. Her mother had lupus, and she wanted to know what I recommend. And, you know, at that time, it seemed like the obvious thing to do was just say, go to the best specialist, the best rheumatologist. They're the ones who would know. How could I possibly ever have anywhere close to a useful understanding of something so complex like autoimmune disease? Only a specialist could make sense of that. So anyways, her mom had terrible complications from lupus, including embolism to the leg of a blood clot with subsequent amputation and a stroke. And she died, and it was pretty awful. And so, you know, I just thought, well, sometimes that happens. Specialists probably did everything they could. There's a beautiful painting here is Girls at the Piano by Renoir. Also, you know, this girl was really helpful for my education. She knew all the classical music, of course. She was a professional musician. And, you know, she loved this Jacqueline Dupre lady who was, like, considered the best cello player in the world at that time. Her husband was one of the greatest musicians in the world at that time as well, Daniel Barenboim. And I mention this to you because she got diagnosed with multiple sclerosis. It was only about 12 years later she's dead. So the point was, with all the best possible treatment available in the world at that time, that's the kind of outcome she got. Dead 10, 12 years later. That's very sad. And I make the point, though, with Roy Swank, MD, he's the neurologist, later Dr. McDougall worked with him. He was reporting with early diagnosis having patients 34 years later, 95% of them with intact ADLs. ADLs are activities of daily living. So what I'm saying is, once again, we'll see, and I realize that's just one case, but he had a bunch of patients he followed. It's been my experience of looking at the treatment of chronic disease that low-fat vegan diet is not just a little bit better than drug-based treatment. It's dramatically better. And nobody knew that in the past, and I was not taught that in med school. And if I had known that, I might have been able to save her mom. Her mom, my old girlfriend's mother, was a great lady. She was a biochemist, super nice. Okay, anyway, so here's a little bit about the leaky gut, what that's all about. Leaky gut is the most common mechanism of autoimmune disease. This is a normal gut wall. Here's leaky gut. So a normal gut wall, you've got these cells that are for absorption of food. The gut is called the enteric tract, so these cells are called enterocytes. They're also the absorptive cells. The cells which line the lumen of something, the lumen meaning the center open part that's connected to your mouth, they're called epithelial cells. So these are also called intestinal epithelial cells. In the colon, they're called colonocytes. Colon for colon and cytes for cells. So the key feature is they have these tight junctions that prevent any food or bacteria from passing in between the cells. Now, what maintains these tight junctions is that the person eats a high-fiber diet. The fiber is converted by intestinal bacteria into short-chain fatty acids, and those short-chain fatty acids, especially butyrate, is used to maintain these tight junctions. In the colon, these intestinal epithelial cells get 2/3 of their energy, so call it 66%, 65% of their energy will come from that butyrate, and that helps them to stay intact. I'll show you a more detailed picture in just a moment. There's adjacent cells called goblet cells that secrete mucus, and that mucus layer is also protective. Now, if a person doesn't eat enough fiber, they don't maintain these tight junctions so well, and sometimes bacteria and bacterial endotoxin, LPS, will get through and get into this area called the lamina propria, which is deep to the intestinal epithelial cells, the enterocytes. These cells right here that kind of have the star-like radiations from them are called dendritic cells. The dendritic cell can also be considered a residential macrophage. Basically, they're immune system cells that sort of guard the area just deep to the intestinal epithelial layer if any bacteria get through or any other things get through that should not be getting through. What they'll do is if they find a bacteria, for example, they'll ingest it. That's called phagocytosis, and they will then take some of its antigens. Those are abnormal proteins, for example, and they'll express them on their cell surface, and they'll contact these other immune cells, or they'll travel to a lymph node, and they'll cause antibodies to be made to that. So the point is, when you get stuff going through this gut wall, it can trigger an inflammatory response from the bacteria itself, from the bacterial endotoxin, or simply you'll allow longer segments of protein to get through the wall of the intestine. Normally, this intestinal lining is only going to absorb a tripeptide, 3 amino acids in a row. There's some papers that'll say an octopeptide, 8 amino acids in a row can be absorbed even, but in general, it's a very small amount of amino acids. In comparison, a protein, a true fully intact protein, can be thousands of amino acids, okay? So what I'm saying is, when you've got a gap between these cells, this is called paracellular, where there's no tight junction, and you get a big chunk of protein in there from an animal, that animal protein chunk could mimic the amino acid sequence of a protein in the human body. But it'll be different enough that the immune response reacts to it, but similar enough that antibodies formed to that long segment protein will then cross-react with the human body. So that's called molecular mimicry, similar amino acid sequences with cross-reactivity, meaning that our antibodies can then attack also tissue of our own body. You know, if you see a picture of amino acid, it looks like a little letter Y. And that guy, Suresh Mukherjee, he wrote the clever books. Like most recent one is called Song of the Cell, and he also did like a PhD in immunology. He calls an antibody like a immunological pitchfork, like it pokes into the antigen, the toxic thing, and binds to it. So anyways, once it binds to it, then it can be ingested by a phagocyte, like a macrophage, monocyte, a neutrophil, for example. Okay, so anyways, I actually just recently went through the 2015 Ivy League, mostly Harvard authors, textbook of pathology. And it doesn't even mention autoimmune. Okay? It doesn't even mention it. I mean, there's a whole chapter on autoimmune disease. It doesn't even mention leaky gut in the autoimmune chapter. That's ridiculous. That is the most important thing you could possibly know about autoimmune disease. It's by far the most important thing. And I talked to a medical student not that long ago, just recently in the last couple of weeks, and the medical student goes, well, this whole leaky gut thing is very controversial. I'm like, no, it's not. There's thousands of papers on this subject, okay? They just don't know anything about it. That's why they got these little naive notions. Medical students don't know anything. I like medical students. They're nice. They mean well. They want to learn. They want to do a good job. They want to help people. But I was the same way when I was their age. All they do is memorize a whole bunch of stuff, but they really don't learn much, and they really don't know how to connect anything. They're not capable of treating a single patient of virtually anything. But, they do a lot of background science that helps them to learn the other stuff faster. And this stuff is easy. By the end of this lecture, whatever it is, about 20 minutes or something, it'll be obvious to you about what to do to avoid leaky gut, the most important things. This stuff is easy to learn. And if I'd have known this, I'd have been able to save that lady's life. Okay, here's some vocabulary. I'll briefly just mention it. It's more if people want to go over this more, they can. Enterocytes, gut lining cells. We talk about the gut mucus layer having an inner part which is adjacent to the enterocytes, and that's got a lot of antimicrobial peptides secreted by the Paneth cells. Anyway, here's the terminology. You'll see this abbreviation, SCFAs. Those are the short-chain fatty acids. Most importantly, butyrate. Here were the dendritic cells we talked about, the residential macrophages. One other concept that's good to know about is MAMPs, PAMPs, and DAMPs. MAMPs means microbe or microbial associated molecular patterns. So that means molecules which the immune system recognizes. Pathogen associated molecular patterns is almost the same thing as MAMPs. And then the next one is DAMPs. DAMPs is damage associated molecular patterns. So this is an important one though to come up for some. There's a few other mechanisms of autoimmune disease. So DAMPs means that if you damage tissue, it'll have a distorted shape and the immune system will recognize it as foreign. That's called DAMPs. That'll come up in the concept of some toxins will damage tissue. But that's a minor thing for the subject of autoimmune disease and compared with leaky gut. Okay. LPS, lipopolysaccharide, that's the endotoxin from gram-negative bacteria. That comes up a lot, and that binds with toll-like receptor, usually abbreviated TLR, and that'll initiate an inflammatory cascade. Okay, here's a picture of leaky gut. A little more detail on the enterocyte lining. So most of them are these absorption cells, enterocytes that we spoke of earlier. Here's a close-up on the tight junction. These Paneth cells, a little bit of variety in the intestinal epithelium. They'll make these antimicrobial peptides that guard the inner layer, if you will, and prevent bacteria from getting up close to the enterocytes. Here's a goblet cell, makes a lot of mucus, and that also has a very protective effect. This is a dendritic cell, and it can extend the little probe-like tentacle, if you will, into the inner mucus layer to sample to see if any bacteria are getting in there. Okay. Okay, what does fiber do? Why is fiber such a great thing? It really is. Fiber only comes from plants, and that's because in a plant cell wall, it has fiber, okay? Meat has zero fiber. Meat stabilizes its plasma membrane with cholesterol. So meat always has cholesterol. Well, the plant, it's the opposite. The plant stabilizes individual cells, their cell wall, with fiber. Okay? Average American only eats about 12 to 15 grams per day of fiber. That's way too low. It's recommended for an adult woman, she should be eating at least 25 grams, an adult man at least 38 grams. But that's really pathetic recommendations for Americans who they know eat a lousy diet in general, a sad diet. Dennis Burkitt felt that it's optimal for humans to probably be eating over 100 grams per day of fiber. I notice that I routinely eat over 100 grams per day because I eat a whole food plant-based diet. You'll get a lot of fiber if you do that. Okay, fiber feeds the good gut bacteria. The good gut bacteria have apparently co-evolved with us, been in our colon, if you will, for hundreds of thousands of years, and however as long as humans have been on this planet, whatever that is. I don't know exactly how many it is. Nobody does. And also, you're going to hear all the stuff about microbiome this, microbiome that, and other different species of bacteria in the colon. And what I'm going to tell you is you don't need to go into that much detail. All you need to know is there's two basic types of gut flora. You get the good gut bacteria from eating plants. You get the bad ones from eating meat and processed foods. And those are really the only two flora you really need to know. So if you eat the plant foods, those good gut bacteria, which are designed to live in our gut and help us, they're symbiotic with us, meaning that it's mutually beneficial. They want us to live. They want us to be healthy. Versus, I joke that the bad bacteria that get in our colon from the meat and processed food diet, they don't give an SHIT whether we live or die. So they're quite happy to erode through the mucus layer, cause leaky gut, and all kinds of other problems. The reason why the good gut bacteria are so helpful is they convert the fiber into SCFA, short-chain fatty acids. There's 2 carbon fatty acids called acetate and 3 carbon fatty acids called propionate, and those travel through the portal vein, which connects the gut to the liver. And the liver just makes them into whatever fat it needs to make them into. This is also one of the secrets why I think that whole slogan of good fats is totally bogus. The best fat there is isn't even fat, it's fiber. And the liver can make most of what it needs just from these 2 things, okay? The butyrate, the 4 carbon fatty acids, those are used by the colon lining sites, the colonocytes, to make their tight junctions, okay? And those tight junctions then prevent leaky gut. Butyrate also does something to slow down the rate of the enterocyte replication, like it helps prevent cancer. It does everything good, okay? It also, when you've got good gut bacteria, just their numbers crowd out the bad bacteria. The fiber adds water to the stool, so it's liquefied and soft. On the right side of your colon, it should be, liquid, soft, not hard like a rock. If you're eating a constipation diet of meat, fiber, paleo, keto, all that kind of stuff, you'll have some dry stool on the right side of the colon, and that can form a peduncle, little rocks in the appendix that obstruct it, and it'll cause appendicitis. I'll show you a picture on the next page of what that's like. When you poop, you should be pooping about 2 to 5 times a day, and it should be soft, more like a cow patty. If it's tubular, it should at least be very soft. Okay, instead of constipation, constipation is associated with only 1 or 2 bowel movements, with 0 to 2 bowel movements per day, and more like hard or goat pellets or Tootsie Rolls. That's what you don't want that. Chronic straining at the stool during defecation, it's called the Valsalva maneuver, when one tightens their abdominal muscles to pop out of poop. That can lead to what's called abdominal pressure syndrome. It's abbreviated here APS. Abdominal pressure syndrome is so common, I would say it's present in the majority of patients after 50 years of age. And it's associated with all kinds, I'll show you a picture on the next page, of all kinds of abdominal complications, super common stuff. Other benefits of fiber is it helps sweep the estrogenic chemicals out of your colon. So normally if your estrogen levels are higher than they should be, the estrogen is transported to the liver excretes it in the bile, and it conjugates it, and then it comes out when you defecate. Excess cholesterol is also sort of rinsed, if you will, washed away into the stool, and that helps to lower our blood cholesterol levels. Okay, here's a picture of abdominal pressure syndrome, and Dennis Burkitt's the one who figured this all out. Dennis Burkitt was a missionary surgeon. He was from Ireland, and then he did some of his medical training in England, and then he was a Christian Catholic missionary surgeon. He went to Africa, and he first became famous for discovering what's called Burkitt's lymphoma, and then he became in charge of the epidemiology for the entire continent, and he studied a lot of these disease patterns. And with the researchers that were communicating with him, he figured out this whole thing of abdominal pressure syndrome. So basically, when you're constipated, you strain at the stool. That'll cause dilated veins in your rectum. Those are called rectal hemorrhoids. Okay, the next thing was that increased abdominal pressure, the back pressure, is transmitted into the sigmoid colon, which is right next to the rectum here, and you get outpouchings of the sigmoid colon wall. The outpouchings are called diverticulosis. This is super common. The majority of patients over 50 in the United States have this. Okay, occasionally these things will pop. They'll perforate from the increased pressure, pop like a balloon, and they leak stool into the abdomen. That's called diverticulitis. The itis indicates active inflammation. It's so common that, it'd be pretty average for having one patient a day, sometimes more, admitted for diverticulitis in most big hospitals. The stool being dry on the right side of the colon, it can obstruct the appendix outflow. There's mucus glands distally. They'll keep on producing mucus, but there's nowhere to go because of the obstruction by the appendicle, and then the appendix will pop and you'll leak stool into the abdomen. The increased pressure from straining at the stool causes the top of the stomach to pop into the chest, and that's called, because this is the esophageal hiatus, that's called a hiatal hernia. And they'll typically reflux acid into there, and they get GERD, gastroesophageal reflux disease. Hiatal hernias are super common. I see them all day long. If I'm looking at abdominal CTs, I'll see them on at least a third of the patients, and it's probably more than that. It's probably closer to half of them. It's super common. Chronic esophageal reflux gives you that heartburn-like sensation. It'll tend to cause change to the lining of the hiatal hernia, and that's called Barrett's esophagus, metaplasia, and that predisposes to increased risk of esophageal cancer. Esophageal cancer, back when I was a resident, we used to call it smoker-drinker cancer, because alcoholics and smokers would get it. But nowadays, it's more common, and that was squamous cell was the histology, the individual cell type. Nowadays, it's mostly adenocarcinoma and from gastroesophageal reflux. Okay, what else? The straining at the stool, the back pressure, is transmitted into the vein. So in the leg, this back pressure is transmitted down, and it can cause the veins in the leg veins to fail, the valves in the leg veins to fail, and then one gets these varicose veins. Super common. In addition, the back pressure of abdominal straining at the stool can be transmitted into the veins of the scrotum and cause a varicocele. So what I'm saying here is, yes, chronic constipation can cause a varicocele, which heats up the testicles because the veins are warm, the blood, and that can cause infertility. Okay, what else? Chronic straining of the stool, increased pressure, can cause a hernia to pop down. That's called inguinal hernia because this is the inguinal area. It's associated with gallstones. So anyways, in, like almost 2 decades of working in a plant-based population, Burkitt said he only had one patient where he had to do surgery of gallstones, and that was, I think, like a Westerner. So low-fat plant-based diet really does great for preventing all this stuff. Okay, what else? When you get leaky gut, the gram-negative bacteria associated with meat in particular can release their endotoxin. Endotoxin is called LPS. It can be absorbed across the leaky gut and cause endotoxemia. So the LPS is quite thrombotic, so it makes your blood more prone to clot. That means that's how people die, is from blood clotting. That's what causes a heart attack, blood clotting. Dying from a blood clot's, many times much more common than dying from bleeding. Some other risk factors for leaky gut. Oh, here, this is a nice one. It basically says the Western diet is the biggest risk factor for leaky gut. It's it's totally associated with obesity and a Western style diet. Okay, this picture just has a little more detail. That it's kind of small here, but when you eat foods that are high in fat like meat, the liver secretes bile acids, or bile salts they're also called, because they function like emulsifiers to help pull the fat from the meal into the aqueous solution, the water part of it, the hydrophilic part of the bowel contents. Basically everything in the water is pretty much aqueous, almost. So when you've got bile acids trying to absorb meat or on a meat-based diet, you're going to get more of these taurocolic, that means taurine-based bile acids instead of glycine-based conjugation. And the net significance of this for our purposes is that that tends to get converted into hydrogen sulfide. Hydrogen sulfide is toxic to the enterocytes. It can cause them to die and go into apoptosis, programmed cell death, and that causes a big, severe leaky gut. When you start getting these things through, the LPS, the bile acids, and you can even get something called oxidized fatty acids, that will also cause damage to the goblet cells. They'll make less mucus, and you get this positive feedback cycle of bad things, a vicious cycle. So, bottom line is, once you understand the problems with meat and processed food, you don't want to eat them. Unless you're starving, I wouldn't eat them. Okay, close bacterial contact with the gut wall causes leaky gut by opening up tight junctions. So yeah, there's tons of papers on this. That hydrogen sulfide also increases the risk of colon cancer. So there's a little more detail over here if you want, but again, it comes from eating meat. Meat increases the risk of cancer in so many ways, it's not even funny. Over 30 ways. All right, here I thought was this is from that same article that that was on the last slide, is that basically this group showed that if you eat a ketogenic diet or a Western diet, really bad for the gut because there's hardly any fiber, so you get leaky gut. And like we said, Western diet is SAD diet, Standard American diet, is the most common risk factor for leaky gut. Now, what's interesting about this paper is you'll see there's a trick here. The trick is that they include the Mediterranean diet and a vegan or vegetarian diet. And then they say that the Mediterranean diet is the best diet. But that's completely stupid because all you have to do is think about a Mediterranean diet for 5 minutes and you can recognize what a joke it is. First of all, as one of the viewers had said to me previously, is there any single thing that's forbidden on the vegan diet? On the Mediterranean diet. I mean, theoretically, the benefit of it is you'll eat less processed food and less beef, if you will, but they still eat tons of bad stuff. They have wine. Alcohol is toxic to the gut flora. They tend to eat animal foods, including cheese, fish, and chicken. Those are all unhealthy, bad for the gut lining. They'll eat, I mentioned chicken, they'll eat nuts as a high-fat food. Olive oil is a really unhealthy food. All that good stuff about olive oil is exaggerations from advertising. So anyways, the point is the vegan diet's the best. It's so obvious it's not even funny. And a lot of papers, what I see happen, it's like a Trojan horse. Try to get people to eat a Mediterranean diet because once you got them doing that, they just don't even know what they're talking about and they eat all kinds of terrible food. I can tell you the typical thing a fat, cognitively slow patient will tell me is, oh, I eat healthy, lots of chicken and fish. Oh, yeah, right. Those are the words of fat, sick, stupid people. Okay, a couple thoughts on leaky gut. Antibiotics kill the bacteria, so those are predisposed to leaky gut because then the bad bacteria start to flourish if there's a lack of good bacteria. Alcohol kills bacteria, same thing as the antibiotics. Glyphosate also does that. It was originally marketed as an antibiotic. Meat will contain herbicides, they're toxic to the bacteria. The meat can contain antibiotics given to the feedlot animals. The sat fat itself is associated with leaky gut. The meat tends to have a lot of gram-negative bacteria on it, and they release their LPS endotoxin. And if those start breaking through the gut wall, that can cause a very severe form of leaky gut. Beef and dairy can cause a special unique thing called xenocellulitis. I've talked about that before. That guy at MedCram has a nice lecture on that too if you're interested. He's a pretty bright guy, that Roger Seaholt. But he's a conventional doctor. I mean, he knows a little bit about nutrition. I think his heart's in the right place. But he's still a conventional doctor. And he's still kind of young. Doctors get a lot better when they get older because, half of a medical education is learning to forget the stuff you were taught during med school and residency because it's not true. And I actually think, you talk to an older doc. I think docs get best when they're right about my age. No, I'm just kidding. Obviously, I'm biased. But you get some personal experience. A little bit older doc, they know what works and what doesn't work. Whereas a young doc only knows what they learned from reading out of a book in school. Okay, processed food. The emulsifiers also cause leaky gut. They're amphiphilic, meaning like an amphibian can live on land and water. And in the context of fatty acid, that means they're soluble in both the oil phase, hydrophobic phase, and in the aqueous phase, water phase. It's hydrophilic phase. So they will increase the risk of leaky gut. We talked about GP doing it for several different reasons, GP being glyphosate. Some of these other weird chemicals in processed food, polysorbate and carrageenan, have been associated with increased risk of leaky gut. Food dyes, they're bad. All this processed food, it's bad in numerous ways. Also, aluminum is bad. Some of the toxic organic solvents used in some of these foodstuffs are bad. Sometimes there's nanoparticles that are bad. Non-organic food, you got more herbicides and pesticides. BT corn, it's taken from Bacillus thuringiensis, and that's how it gets the BT name. It's registered as a pesticide. It'll kill insects by punching a hole in their gut. Well, guess what? It could potentially do that to your gut as well. When you get leaky gut, it'll cause an increased risk of allergies. When I was a kid, almost no one had an allergy. Nowadays, it's pretty routine for kids to have allergies. Okay, these are just some papers showing some problems with BT corn. Endocrine disrupting chemicals, they can have a negative effect on the immune system, kind of increase it in some ways, decrease it in other ways. And about almost 80% of autoimmune diseases are in women. And it's because, having a baby is a little bit like having a transplant. So they have to suppress the immune system in some ways so the body doesn't reject the baby. But they actually increase it in other ways, with the net effect being they're more vulnerable to autoimmune diseases. You can also get leaky gums. Leaky gums will have the same effect as leaky gut, in the sense that bacteria can get across the lining of the mouth, the epithelium of the mouth, and get into the blood and cause all kinds of inflammation problems and autoimmune problems. High fructose corn syrup is associated with increased risk of leaky gut. All of these these vegetable oils are bad. Some medications like NSAIDs, aspirin, PPIs, proton pump inhibitors are associated with leaky gut. It could also be because they're changing the gut flora and more of the bad bacteria survive getting through the stomach. Chlorine in your water and F- are bad. It's good to have a whole house carbon water filter. It's good to have a kitchen reverse osmosis filter. F- can also distort the shape of molecules and cause them to be damaged and recognized by the immune system as DAMPs, damage associated molecular patterns, to incite an immune response. It's best to have your toothpaste to not have F- in it. I went to the grocery store recently and I couldn't believe it. I would say over 95% of the toothpastes, shelf after shelf, had F- in it. And the companies would put it right on the label, anti-cavity F- toothpaste. And I thought, that is insane. And it's so sad that the American public is such a bunch of ignoramuses. I mean, it's been known since, at least the 1980s pretty well that F- was toxic stuff. And still, it's not known by the public. I mean, the aluminum companies got it into the water supply. Then they sort of tricked the dentists into thinking it had a big benefit for preventing cavities. And so there it is today, and most people don't realize how toxic that is. And it must be the case that most people don't realize, because almost every single toothpaste, and all the best-selling ones where they got tons of them on the shelf, contain F-, and they advertise it on the outer part of the package. So that does not make me feel too hopeful for the ability to educate the public about anything. A little bit like Napoleon said. Napoleon said that, a wise person reads and thinks and talks, but, a stupid person, they just take whatever authority tells them and they just accept that. And sadly, in my experience, that's true. Dishwasher soap, increased risk of leaky gut. I always rinse my plates and bowls off, and I hate using the dishwasher. Artificial sweeteners will increase the risk of leaky gut. Non-stick cookware with the PFAS, PFOA, that's also related to F-. Better to cook on stainless steel. These are additional things. Excessive psychological stress can do it. Stress equivalents like sleep deprivation, caffeine, corticosteroid medications will all increase the risk of that. Gliadin is a breakdown product protein from gluten. Some people are gluten sensitive. And here's just some more things that are associated with causing leaky gut. Okay, children do better if they have a vaginal delivery in terms of getting the gut flora at the time of birth, but they're going to eat 3 times a day, and then my old joke was, if a woman has a baby by C-section, should she put her finger in her vagina and then in the baby's mouth to transfer the bacteria? It's edible, not edible. I don't know if she should do that or not. Somebody who actually works with that population would know better than I do. Alessio Fasano is a real famous guy. He's at, the Harvard hospitals. He's a pediatric gastroenterologist. He wrote a nice book about leaky gut. I think he's written 2 books about leaky gut. And I read one of them. It's pretty good. He's kind of a likable, clever guy, but like all university academics practically, they always weasel out in the end. And the reason is he's trying to make a lot of money coming up with medications for leaky gut. So if there's no way in the world some ivory tower academic is going to tell you, look, all you got to do is eat the right food and avoid the toxins, and you're very unlikely to get leaky gut. There's no way he's going to just come right out and tell you that, but that's the case. Anyways, another hot topic is fecal transplant for treatment of leaky gut, where they'll actually, like almost through like a colonoscope-like device, just infuse somebody else's feces into another person to reestablish someone's gut flora. So my joke is that if a wife is suffering from leaky gut, should she kiss her husband's butt and take SHIT from him? That's a fecal transplant. But obviously that she doesn't need to do that in most cases. If somebody just eats the fiber, they'll be able to reestablish their gut typically. Don't get me wrong. There might be some times where they need this fecal transplant. Okay, fine. But I'm just saying is, if I thought I had leaky gut, I would just make sure I eat more fiber. Okay. All right, there's tests. I don't really want to get into these because, like I'm saying, is if you think you have leaky gut, just start eating more fiber, avoid processed food and meat. Okay, and then see if you get better. And if you don't get better, then you can start thinking about all these tests. But I think too many people just run for all this testing. Why test? Why not just cure yourself? And the same diet that makes you healthy in general is the one that's going to cure you. So just do the right thing. It's not that complicated. Also, take good care of your teeth. You know, I don't eat sweets or acidic foods. Soda pop's really bad because it's not only sweet, it's sticky, it sticks to the teeth. It's also acidic with the phosphoric acid in there. You can try elimination diets. That might help. Like avoiding, first of all, meat and dairy, then oil, and then gluten, etc., whatever it seems to take to work towards it. Okay, also aluminum gets into the food, gets into the water. They put aluminum into municipal water filtration because it helps to so-called clarify the water, but it's not a healthy thing. It's toxic to the enterocytes. It opens up tight junctions, increases reactive oxidative stress. This article here says it causes, 38 times increased reactive oxygen species. You know, this is a superoxide right here. So that's pretty toxic. Another one here, aluminum-induced intestinal dysfunction. It's another reason why I don't eat out of can if I have a choice. If I'm starving, I would do it, but otherwise I wouldn't. Here's another article talking about the damage the aluminum in food and in water causes to the intestinal lining. The crypts are crypts of Lieberkuhn. They're at the bottom of the enterocyte villi, which are finger-like protections of the intestinal lining to increase surface area for absorption. You can remove the aluminum by reverse osmosis, distillation, ion exchange filters. Okay, in patients with multiple sclerosis, there's 10 times higher amounts of iron in general on average. So they just find it more commonly in people with serious neurodegenerative disease, including dementia, so-called Alzheimer's type. But Alzheimer's type, I think, is an overrated term, as I talked about in my dementia lectures. There's also inhalation of aluminum, and this is thought to be much more common than is widely recognized. And I have sometimes driven home and noticed that I'll look behind a passenger jet and I won't see any of this sort of stuff, but then I'll see this sort of stuff all over the sky, so it makes me wonder, is it coming from a different source? I think it probably is. It's known to at least contain aluminum. And then other things I've heard are barium and strontium. I'm not as sure on their toxicology. This is certainly a neurotoxin. And we also talked about it causing leaky gut, which suggests that it increases one's risk of autoimmune disease. So I don't think that's a good thing. And it's another reason why I don't want to live in one of those 15-minute places that are all crowded together, and there might be more of that stuff. Anyways, the whole purpose of this lecture was primarily to let patients with autoimmune diseases know that leaky gut is probably, there's certain exceptions, but it's probably the causative mechanism. As far as we can tell today, it certainly seems to be in a big way. Dr. McDougall's got page after page of all these testimonials of patients cured with a low-fat vegan diet. And I believe there's really good reason to think that it's a great thing for helping a lot of these patients. So anyways, I also have a lecture on checklist of leaky gut when I go through some of the individual items in more detail. So And MS is a unique disease compared to all the other ones because it involves the brain and you got to cross the blood-brain barrier. And I kind of talked about that in my Effective a High-Fat Meal on the blood-brain barrier diet. I also gave a lecture. I gave other lectures on this subject before. So anyways, I hope that's helpful.